Chief Executive Officer, Chief Medical Officer, and Chief Nursing Officer. I am here to address a dire need within our healthcare system, the creation of advanced practice nursing ground rounds. Nurse practitioners have a graduate level education and hold either a master's or doctoral degree by incorporating the nursing background and current clinical expertise to provide high quality primary acute and specialty health care across the human lifespan and within diverse populations. 70% of all advanced practice providers within Zen County are nurse practitioners. Yet there are no current opportunities to introduce new and many times improved practices evolving through the healthcare system within Zen County. Evidence-based practice is a method to translate the latest scientific research into healthcare delivery. Educating healthcare professionals about new theories and evidence of success and failures within healthcare and their underlying circumstances ultimately leads to improved patient outcomes. It takes about 14 to 17 years for new evidence to be broadly implemented. That is over a decade for a best practice to be adapted as a standard of care within any hospital. Shortening this timeframe is key to providing the best possible outcomes for our patients at Hospital Zen. Advanced practice professionals need to provide peer feedback of what is working within our hospital and to have the opportunity to evolve clinically. The amount of information available has been exponentially increased by the creation of the World Wide Web, the various internet search engines, and online sources. But to explore all the research and best practices available is beyond the capacity of one provider. I propose to start a countywide advanced practice ground rounds in which evidence-based practices can be reviewed and discussed in a peer environment or setting to assure the continued high-quality healthcare that advanced practice disciplines provide. Evidence-based practice is the gold standard in delivering the best possible care to patients, and it is imperative to incorporate an educational platform separate from those provided by the Center of Professional Development to Hospital Zen. By providing innovative learning methods, we can help advanced practice providers maintain their competencies and improve patient care. Sessions will focus on evaluation of management of acute and chronic illnesses across the lifespan, as well as professional development topics. The primary target audience would be nurse practitioners as they comprise the largest portion of advanced practice providers, but with the information will be given to allied health care providers. This includes certified midwives, certified registered nurse anesthetists, physician's assistants, and students of each discipline alike. In two benchmark reports by the Institute of Medicine, To Err is Human, Building a Safer Health System and Crossing the Quality Chasm, a New Healthcare System for the 21st Century, the importance of providing a variety of topics that cross specialties and disciplines was emphasized. Therefore, topics covered will be rotated by various departments within our hospital and will cover topics such as pain management, neurological disorders, and pediatric cases, as well as low frequency and high risk scenarios. To have a successful program, creation of an advanced practice educator role is needed. Continued use of the Center for Professional Development is required, and a collaborative relationship with the current lead nursing educator. Continuing education is a needed investment for the professional development of advanced practice providers. By working collaboratively with the Center for Professional Development, or CPD, the cost of initiating ground rounds will be nominal. The largest anticipated cost would consist of presenter fees, but the presenters or guest lecturers will consist of staff seeking opportunities to present and teach their peers. Therefore, this cost will not be incurred. The funding for continuing education credits, or CEs, will be done by the licensing already in place via the Center for Professional Development, and technological support and conference rooms are currently available and open for use to all staff development projects and will therefore not incur an additional cost. Sufficient funding exists within the to support better learning via the Center for Professional Development. The first ground rounds will begin in February and continue monthly on the first Tuesday of every month from 12:20 to 1:20 p.m. in person and subsequently available through recorded sessions. In 6 months, the frequency will increase to bi-monthly to the first and third Tuesday of every month. At this point, a needs assessment survey will be circulated to the NPs or the nurse practitioners to determine changes that would need to occur regarding times, dates, and content. Who are we competing with? We're competing with other magnet hospitals that support professional development And we are also competing with other local hospitals that support professional development without being magnet status, as well as competing against ourselves with our own productivity. We need to implement ground rounds to foster a work environment in which continuing education beyond the formative years is supported and expected. Our patients deserve care that is not mediocre and of the highest quality. In 2003, the Institute of Medicine report, Health Professionals Education, A Bridge to Quality, acknowledged 5 core competencies that are providing patient-centered care, working with interdisciplinary teams, employing evidence-based practices, applying quality improvement strategies, and the use of health informatics. At Hospital Zen, we can do our part by implementing ground rounds for advanced practice providers and elevating our care. Below, you'll find my contact information if you have any further questions or concerns. Here's the appendix of the resources used for the presentation. Thank you very much for listening to me, and I hope to hear from you soon.